Welcome to the eMint Healthcare Guide for point-of-care testing. When a client hands you a sample, you are holding a critical piece of their clinical data. There is no room for estimating or close enough. By the end of this module, you will know exactly how to collect, time, read, and document every test cup, swab, and strip used in our facility with absolute certainty. A urine drug screen, a pregnancy test, or a COVID swab drives immediate clinical decisions. These results determine whether a client stays in residential treatment, transfers to detox, or receives specific medications. Executing these procedures by the book protects the client's recovery path. It also protects your license and eMint Healthcare's compliance standing. Let's look at how to get it right every time. Step 1 happens before the client even enters the room. Accurate testing starts with strict preparation. First, verify the provider's order in the chart. Next, confirm you have an active, signed competency on file to perform this specific test. Finally, inspect the test kit itself. Look closely at the packaging. If the kit is past its expiration date or was left out in extreme temperatures, throw it away. Then, locate the alphanumeric lot number on the pouch. You will need to record this later. When you meet with the client, confirm 2 patient identifiers, usually full name and date of birth. For any urine collection, eMint policy dictates that the observing staff member must be the same sex as the client. To prevent adulteration, have the client empty their pockets completely into a secure area. You must also check waistlines and socks before handing them the collection cup. Once the sample is provided, check the temperature strip on the cup within 2 to 4 minutes. A valid, unadulterated sample will register between 90 and 100 degrees Fahrenheit. By following these pre-checks and controlling the collection environment, you eliminate the physical variables that most frequently ruin a test result before the testing even begins. Now move to a flat, clean surface where the chemical execution actually takes place. Manufacturer time windows are absolute. You cannot estimate the time. You must set a dedicated timer the moment the specimen interacts with the test. Our standard urine drug screens are read at exactly 5 minutes. Pregnancy tests are read between 3 and 5 minutes and never after 7. COVID rapid tests take exactly 15 minutes. Look at the top of the reading window. Every Waived test has an internal control line, marked with a C. This line is your proof that the chemical reagents in the kit actually functioned. If that control line fails to appear, the test is invalid. Stop right there, discard the test, log the failure and the kit slot number, and repeat the entire process with a brand new kit. Warning tone. Never report the results of a test with a missing control line. Any test lines that appear underneath a failed control mean absolutely nothing. The timing restrictions and the internal control are rigid scientific boundaries. Bypassing either of them destroys the accuracy of the test and nullifies our CLIA certification. The single most common error in point-of-care testing happens right here: misreading faint lines. The rules completely flip depending on the type of test you are running. This graphic shows a urine drug screen. On a UDS, any visible test line, no matter how faint, is a negative result. A completely blank test area is what signals a presumptive positive. Contrast that immediately with a pregnancy test. On an HCG cassette, any faint test line means the hormone was detected. A faint line here is a positive result. Mixing up these 2 rules alters a client's medical trajectory. You could clear a pregnant client for teratogenic medications, or incorrectly discharge a sober client for a relapse. Once you read the result correctly, document it immediately. Your entry must include the result, your initials, the date and time, the kit slot number, and a specific note verifying that the internal control line was present. If a test is positive, trigger the escalation protocol. For a positive UDS, keep the client in your direct line of sight until a supervisor arrives. For positive fentanyl, pregnancy, or COVID tests, notify the medical provider immediately. Combining accurate visual interpretation with immediate, thorough documentation turns a simple chemical reaction into a permanent, actionable medical record. Back on the floor, the process becomes second nature when you stick to the framework. Always adhere to exact manufacturer timings. Prioritize the control line above all. Know your faint line rules, and document every single variable. You now have the exact procedural steps needed to run point-of-care tests independently across our programs. We enforce these steps because inaccurate test results lead to incorrect treatments. This precision ensures our clients stay safe. Treat every test like the medical procedure it is. Execute them flawlessly, every single time. The integrity of your client's recovery path depends entirely on the accuracy of your results.